To ask for your permission to use this video for educational purpose and on the internet.
Yes, go ahead.
So, how long before the surgery, which was 3 months ago, how long before the surgery did you have pain?
Like I said, close to 30 years.
30 years.
Yeah.
Well, how bad was the pain?
The pain was anywhere from numerically, from a 5 to a 10.
So it could be up to 10.
Yes, absolutely.
How bad is the pain now?
Oh, it's maybe, I don't know, 4, 5.
4, 5?
Some days.
Some
days it's fine.
Fine. Now, specifically, you had leg pain before the surgery.
I did.
Was that leg pain as well, 8, 9, 10?
Yeah, it was also up there, yeah. It was
How-
more like 7, 8, like that.
Yeah.
In that.
And how bad is that leg pain now? Is that gone or still there?
No, it's still, it's a different kind of pain.
Mm-hmm.
As I say, when I move my leg to laterally like this,
Mm-hmm.
like in bed, for instance, it hurts all the way down to here.
Mm-hmm. So
That's-
when you do some kind of extreme action or
Yes.
extreme range of motion.
Yeah, exactly.
Yeah.
Yes.
But generally, that sharp pain you had before the surgery going
No,
down the leg, that's gone?
It's gone.
When did that go away?
About a month, 2 months after surgery.
Yeah, okay,
Maybe
so-
a month and a half, like like
You
that.
see that there, most of my patients actually telling me they wake up, that pain is gone. But sometimes, as you just said, that can take a little longer
Right.
to go away. Now, in your case as well, is not the one of the best, everything went the best, because
Well,
you were discharged the day after the surgery, but you have to come back to the hospital because you had problem with your bladder and prostate.
Yeah,
and,
right. That actually wasn't related to my. Well, there was pain, but I was on the pain
Yeah,
pain medication. So it was because of the catheter I had.
catheter, yeah. And you see that's why I'm taking this testimonial, because people are not just made out of their spine.
Right.
They have other issues. There are other issues related to the
Right.
surgery. Like in the surgery, we have to put a catheter in. Sometimes that causes itself an injury and so on.
Oh,
So
never again. Never again.
but overall, we did a big surgery. Let me turn
Yeah,
around. We did a
yeah.
3-level fusion, and amazingly, your bone is growing beautifully.
Good,
Just
doctor.
3 months after the surgery,
Yeah.
everything is good. And you had a huge scoliosis. Now it's mostly corrected. Still not corrected to 0.
Yeah.
But you could correct it with a surgery that was about 1 hour and 10 minutes, and we have less than a cup of coffee blood loss in your surgery. So people usually recover from that generally easier than a big surgery
Oh,
that
yes,
put
yes.
you at significant more risk. Now, still is a surgery. Like you had problem with your bladder and the catheter,
Yes.
and as well, certain activity is still painful, but overall, I think we are going the right direction. CAT scan looks good.
Yeah.
Your symptoms you're describing, they are all on the way
They're
of getting
improving. Yes.
better.
Yes.
And that is exactly for my patient to know that sometimes spine needs a little more time to heal. Now,
Right.
what we can compare it with the open old-fashioned surgery, that many times is not even an option in somebody who's
No.
in the higher age.
I would live with
group.
the pain before I would do that.
Yeah.
Really.
Because the surgery can be truly damaging itself. So we're on the right path, but we just have to be more careful, give it more time to heal.
I will.
And the rest of it is just the healing process and the more time for the bone to become stronger.
Okay.
Well, thank you so much for the interview. I really
Yes,
appreciate
surely.
that.